the Sim Lab or the Active Learning Center provides this safe environment for learners who come in here and practice their skills so they go up in the real world to take care of patients prepared and less anxious.
So when our learners come in, they know that we are not going to, they won't be criticized for how they perform. We stress this is a learning environment, and this is the place to make mistakes.
We have our high fidelity sim man here. You can feel his pulse, you can get blood pressure on him, you can intubate him, you can do all these skills that really helps just make it as real as possible. If we try to make him cough, we just click here. We can make him, start having a seizure. If the patient gets really sick and they start getting really sweaty, we can make him start sweating.
Over here we have the central line man. We have the kits. We get all of the expired supplies from the hospital and other places. We have the ultrasound, so they can use the ultrasound as they would in the hospital.
So this is our task trainer for intradermal injection, where we teach the physicians how to give numbing medication, which they use pretty much for every procedure they do.
We have a pediatric high fidelity mannequin, and we have him set up. He can be intubated. We want to remind people they are not little adults. They have, their own needs.
Over here we have the IV insertion models, where nurses, even physicians, if they want to, can learn how to insert an IV. We let them practice, and as you can see, we have this red dye that mimics blood. We use real sutures, real equipment. We use these pads that they can practice on.
This is the FLS trainer, so the fundamentals of laparoscopic surgery. And we have the surgeons, physician's assistants, can come in and practice, learn how to use the instruments. And these tools, we get them from a company for the purpose of FLS, but they are the exact same tools that they'll be using in the OR. And so really getting your hands on this, and I watch them, and it's so interesting because you can just, that they're going to take this back with them. And something else that we have both experienced is that we'll have one of our learners come back and said, I just did that skill that we went through in the Active Learning Center. It felt so good to have already seen that equipment and practiced that procedure down here. So that's really gratifying. This is a community hospital. It serves a rural area. My family members certainly come here. And so I feel what the community can know about the Active Learning Center is we're teaching the physicians, the nurses, the skills that they may experience while they're in the hospital, and can give them the confidence that they're being trained very thoroughly.
And provides the best care for our community because they're going through this rigorous training before they practice the skills. So it gives you confidence as a family member, as a patient, to come to Bassett.